Evidence to improve mental fitness and student outcomes in just 5 minutes per day. The only app of its kind, FIKA is designed by experts to develop the 7 skills of mental fitness, which are proven to prevent mental health decline. Better mental fitness can lead to greater outcomes, including increased student performance and confidence, improved stress management, reduced dropout rates and burnout, and meeting Ofsted targets. Better mental fitness also supports students' employability when they leave education. Measurably improving mental health in education is a huge priority for us. That's why NCFE has partnered with FIKA to offer 1-year free usage of the app to a limited number of further education providers. Licenses have already been claimed by providers around the UK. To get involved, book your place on one of our Discovery demo sessions today and find out how to claim your centre's free trial.
Hello everyone and welcome to today's Roundtable event, where I'm joined by esteemed colleagues from across the sector for what promises to be a really interesting conversation around an incredibly important topic, which is all about mental health and well-being in further education, in FE, our tertiary education system, and our priorities post-pandemic. So lots to think about and lots to talk through today. And initially, what I'm going to do is just go around the room of panelists just for a brief introduction, and then we'll get into the conversation, which I'm really looking forward to. So first up, could I go to Jane Hickie, please?
Thank you, David, and it's a pleasure to be here. My name is Jane Hickie, and I am the Chief Executive of the Association of Employment and Learning Providers, which is the trade body representing independent training providers across England, but with a more diverse membership also, with colleges, schools and suppliers in membership, but predominantly independent training providers.
Fantastic, thanks Jane. Could I go to Nick Bennett next, please?
Hi, David. Thank you. And great to be with everybody here on the panel and to meet everybody else who's listening. My name is Nick Bennett. I'm co-founder and co-CEO at FIKA. FIKA, the mental fitness platform, the business that I founded over 3 years ago after my best friend by suicide. And the business that I have created with my team has been about fixing and the education gap that we have in our country, the mental education gap. So there's a mental fitness and education curriculum of 7 key skills, and we use that to help to support our education partners across the UK. And we're currently working with 50 education partners in the UK at the moment.
Fantastic, thank you, Nick. And next I'll go to Janet, please.
Hi, David, and hi, everyone. My name is Janet Caro. I'm President-elect of the University and College Union, which is a trade union that covers post-16 education, including FE, prison education, adult and community education, and higher education and universities. I also work in an FE college teaching trade union education at the Manchester College.
Okay, fantastic. Thank you, Janet. And Jill, hello, good to see you. Should we go to you next, please?
Hi, David. Good to see you too, and all of my other esteemed colleagues here. Jill Whittaker, and I'm the Managing Director of HIT Training and also of Connect to Care Limited, our sister company. During last year, we've completed over 1,000 courses in first aid for mental health for the employers that we work with, and we've seen a big change in the way that mental health is impacting in the workplace. So I'm really interested in that.
Great stuff. Thanks, Jill. Paul, could we come to you next?
Yep. Hello, my name is Paul Warner. I'm the Director of Research and Development at the Association of Employment and Learning Providers. Also have a particular specialism in provision, post-16 provision for special educational needs and disabilities. So all of this is an area of intense interest for me.
Brilliant. Thank you, Paul. And then we'll go to Jane next, please.
Hello everyone, my name's Jane Caro and I'm the Associate Director of Programmes at the Mental Health Foundation. We're a national charity that's been around for over 70 years now, and we have a particular focus on prevention of poor mental health. So we feel strongly that we shouldn't be waiting until people reach crisis point. We need to be doing much more to support people not to get to that state of distress. We host Mental Health Awareness Week every year. So yeah, I'm very interested. We've got a lot of programmes at the moment in the kind of education space. So really interested in the discussion around FE in particular today.
Fantastic. Thank you, Jane. And I'm sure today over the course of the conversation, we'll get into that good old adage that prevention is always better than cure. So I think you'll have lots of smiles and nods around that in particular. So Anna, can we go to you next? Good to see you.
Hi David, thank you, and good afternoon to the other panellists as well. Anna Morrison, founder and director of Amazing Apprenticeships, and we're probably best known for our work around widening access to apprenticeships and the work that we do with schools and colleges and employers and underrepresented groups. But for the past couple of years, we've been doing a lot of work with the sector around mental health and well-being, and this has really come forward in the past year as a result of the pandemic, working with and supporting training providers, employers and apprentices. So thanks for inviting me along today.
Brilliant, fantastic, thank you, Anna. And we'll go to Lachey next, please.
Hi everyone, sorry about the noise in the background, my flatmate. But my name is Lachey. I am representing the Association of Apprentices, and I also am a digital marketing apprentice from the West Midlands, and I'm currently 2 months to the end of my apprenticeship. So yeah, looking forward to that.
Fantastic, thank you, Lachey. And don't worry about the background noise, it wouldn't be the same without a child interrupting, a barking dog and some music or some drilling or something. So it's just keeping it very authentic today, thank you. And we'll go to Liz, certainly, well, last but certainly not least. Thanks, Liz.
Hello, David, and hello, colleagues. I'm Liz Bromley. I'm Chief Executive at NCG, which is, I think, probably still the country's only national college group. We've got 7 colleges, 6 FE colleges, 1 sixth form college. We serve around 40,000 students, part-time and full-time, and we have around 2,500 staff. So we are busy trying to determine what a new normal is going to look like and what culture and behaviours will support that new world as it normalises, if it ever does.
Okay, fantastic, Liz. And I'm really pleased that you've all been able to join today. It's great to get such a cast together for this really important conversation at such an important time in society more broadly, but definitely in our sector as well, which I know that we all care about very deeply. There's one phrase that I've come across a few times over the last few months, as I'm sure many of you have, that I think is most pertinent for me, at least, to start with. And that's the fact that over the last year, that we've all been, we've not necessarily all been in the same boat, but we've definitely been in the same storm, you know, as extraordinary challenges that we've all faced in our personal lives, in our family lives, at home, at work, and then, of course, in the world more broadly, you know, whether that's the challenges of homeschooling, you know, losing a loved one, not being able to be there to care for a loved one, you know, keeping businesses going, keeping families going, keeping ourselves as healthy and as mentally fit as we're able. So I think this last year, that whilst it's been an absolute tragedy for many people, many families and many businesses as well, actually, one of the huge silver linings that I'm seeing in everything that's gone on in the world is this conversation and it being opened up to speak very positively and openly about what can be done to improve the mental fitness of the nation, you know, to get us, you know, back up, not just on our feet, but really running again towards, you know, a much better future. And so that is, you know, very much, I suppose, the context as I see it for this conversation today. Really keen to hear from the different perspectives, the different vantage points, you know, what are the challenges that we're facing? What are our priorities? What can we do individually and collectively to make a positive difference in a sector that I know that we all care about deeply? So the sorts of questions we're going to be exploring today, and I'm going to come to Nick first of all, just to give him a bit of a heads up on this. So we're going to be looking at how has the pandemic affected us as a nation? How has it affected our health and well-being? how have organisations adapted? How have we adapted, as leaders and key figures in the sector? How have we helped our teams? What have we done at home to deal with that? What strategies could we and should we be deploying? What do we need to do now, and what might we need to do for the long term? And within further education, what do we see as the priorities to really improve our situation as we recover from the pandemic, and hopefully, over the next few months and years, actually create a better world, not necessarily like the one that was pre-pandemic, but something even better and even stronger. So that's the conversation today. So I'm looking forward to a really interesting conversation. So Nick, you had a little bit of advance warning there, so I've just given you a little bit of filler time to have a think. So how do you see it? How do you see the impacts of the pandemic on the health and well-being and mental fitness of the nation? And what do you see as some of our big priorities, particularly within further education?
Well, thank you, David. I'm happy to take that as a first question. It's a big question. I think there's the FE Week supplement has a huge amount of information in there around the troubles and the challenges and the difficulties. I think if I was to try to summarize the challenges that we have faced, I think have put a spotlight on mental health. I think one of the key things that we have seen from our partners that we work with and from data and research in the UK is that there has been a focus on our mental health because we've been restricted physically. So I think the thing that has been quite an interesting observation is that the pandemic has forced a sense of contemplation, and with the physical restrictions, I think everyone has, to a certain extent, spent a little bit more time thinking about mental health, simply because physical health has been restricted and physical fitness and activities have been restricted. And I think, both for employers in education, for their staff, and for the wider populations of the students, there has been a broader concern for mental health. And this has been exacerbated principally because we've all gone through a huge transition period. And I think transitions are periods of time of change. And as humans, we're not very good with change. We're not good with new routines. When our routines have been taken away, it creates anxiety. When the future is uncertain, it creates anxiety. And we've certainly seen the results in the press around the rising states of anxiety. And we actually conducted our own national research with NCFE as part of our partnership to support the further education sector this year. And we found that 76% of British people are very concerned about how they will cope mentally in the year ahead. So that's really interesting that there's now a real concern for the future. And that concern is manifesting in increased anxiety and increased worry about what's going to happen in the future. And I think the difficulty here is that we're all suffering and going through continued periods of change. One of the other questions that we asked in this survey, we asked about the importance of mental education, and could that potentially have made a difference to how we have coped with the pandemic and how we could cope with the pandemic. And what we found was that 80% of British people said that confidence as a hold-all for mental education and mental fitness is as important and should be taught as often as maths and English. And I think as a headline for what we're very concerned about at FIKA and our mission to mainstream mental fitness is this education gap. And I think the highlight for that area is that the pandemic and this period that we've been through has really highlighted the fact that education gap, which has been missed and isn't mandatory in our country and isn't mandatory in our curriculums, a light has been shone on that and the importance of helping to rebuild those skills and make sure that they are more formalized in curriculums, because that is definitely something that we've seen from our data.
Yeah, brilliant. Thank you for those opening remarks, Nick. Jane, Caro, I'm going to come to you next, if that's okay, to have a broader sense as you see it. So the same sort of question that I posed to Nick. But within that, I'm interested in, has our mental health suffered as a nation? I've heard some real positive stories about where people's situation has improved, but quite the opposite of that, where people are in absolutely horrendous situations and have gone right to the brink and sometimes beyond in terms of, arriving in mental health crisis, and that being catastrophic, for individuals and families. So, and one of the things from a personal perspective, I realised a long while after it started, I've suffered from what I describe as lockdown guilt. Always feeling that I'm letting somebody down somewhere, whether it's my children at homeschooling, whether it's NCFE colleagues, whether it's my parents because they were shielding and I couldn't be there for them really. So that was something, and I thought, if I'm experiencing that in my situation with what I've got around me in terms of the support, well, how tough must it be for other people? So what's going on from your perspective? That broad perspective of the mental health and fitness of the nation.
I completely agree with the point you're making, which is there isn't a one size fits all. And I think whilst for all of us, we would acknowledge this has been a huge kind of collective trauma, really, I think it's really important to be aware that we will have all experienced things differently. If I use the example of young people in particular, for example, young people who maybe are already struggling at school, finding things quite difficult, struggling at college, struggling at university to be there in person, may well have found this quite a positive experience. I know there's lots of young people who usually are highly anxious about attending in person, who this would have been a welcome break. There are other young people, just using young people as an example, who will have been at home in extremely crowded housing conditions, finding it extremely difficult to do some of the work that they need to do, etc. We're all different as people. We all bring different experiences to this experience of the pandemic, and we will have all lived through it in very different ways. So I know it's a frustrating answer to say it's very mixed, but it is very mixed. But on the whole, I would say it's a huge challenge. But it is important to remember that it affects people differently. One of the things we've been doing as MHF, the Mental Health Foundation, throughout the pandemic is carrying out a COVID study. So we've done 3 rounds now of data collection through YouGov surveys for both adults and young people. And one of the findings, for example, for both age groups is around loneliness. Now, loneliness tends to get talked about, particularly for the older generation. And actually what we're finding is significant issues around loneliness in younger people. And I think it's really important we remember that actually there's something so important about the ability of young people to be able to connect with other young people. It's so important to their developmental stage. And the fact that things have been really disrupted in terms of how they used to making contact with other people, I think is really important. And the final thing there have been some quite unhelpful narratives that I think will be important to highlight, such as ideas around the lost generation. Some of these things can be quite a self-fulfilling prophecy. And I know if I'm told I'm part of a lost generation, that's not going to help me feel positive and geared up for the future. So I think we need to be quite careful about the way we're framing things. Yes, it's incredibly challenging, but there have been incredibly challenging periods of history previously that people have come through. And just to say, and I'm sure we're going to come onto it in more detail later in the discussion, we very much feel as the Mental Health Foundation that an awful lot more needs to be done on a preventative basis here. We know this is going to be challenging for people. I think it's very wrong to sit and wait around for young people, for older people to then present to mental health services. There's a lot we can be doing as a society. There's a lot we can be doing in the different organisations that we're in to start talking about the emotional impact of this on us. And even just that process of talking about it is very beneficial for our mental health.
Okay, fantastic, Jane. Thank you. And so much that we could talk about in there, and we will, of course, as we go through. Just a couple of things to pick out. I think what you described about everybody's unique set of circumstances, it's why the same storm but different boats analogy really resonates with me. Because I did early on in the pandemic, people saying we're all in the same boat, and we're not. It's just not, it's not true, and it really does resonate. The point around lost generation, you know, I've thought about that as well. Actually, I think language is really, really important in terms of us getting that right. And, you know, should we say lost generation, or the generation that got through COVID, that got through a pandemic and they come out of it, you know, wiser for it, stronger for it, hopefully, if we can do the right things to help them. And so, you know, to show that resilience and resourcefulness to find a way through, wow, what an incredible thing. And on the loneliness point, you know, that I didn't realize this. I don't want to talk about me at all, really, but a few weeks back I drove up to the office, and it was the first time I'd been on my own almost for about 3 or 4 months, and I absolutely loved it. And I know that sounds quite selfish, but I'm just around my wife, my children, and now my parents, because I can see them a bit more constantly. And I've been used to spending time on my own, and I've suddenly realized I've missed this, you know, a little bit of time for me, which I know it sounds a bit selfish, but it's just those moments where you realize actually everybody's just facing such a unique set of situations. So yes, it's an interesting all sorts that you've described there. Liz, I'm going to come to you next, because of course I know that you and NCG have really thought about this a lot. You're doing lots, you know, to support your people and support your students. So I'm really interested in your perspectives. And for a large, complex organisation dealing with complex challenges, ever-changing, you know, circumstances, how have you coped, and how has your organisation coped, and what are you doing for learners?
Absolutely. It is complex, because when you have thousands of staff and students, you also have thousands of different perspectives. And to use the analogy of, you know, everybody's in the same boat. No, some people are on a life raft and some people are in a luxury yacht. You know, they're not the same boat at all. So we have tried very, very hard to learn as much as we can about the different perspectives of our staff and students by meeting very frequently as a senior team, encouraging the next layer down to meet very regularly with their team. And so we've got a cascade of information going both ways up and down the organisation, so that we really understand the difference. And I'll give you some examples. I had 4 children once in my life, and the me time came from not being in the house with 4 kids, but for being in the office. So I know there are a whole group of parents who've got lots of, you know, domestic responsibilities, for whom the office is a safe haven. Now I'm on my own with nothing but the destructive dog. And so that sense of loneliness of being in the office and of being in the kitchen, not in the office, not seeing people, not being able to just have a moment of levity as well as getting the business done. You know, I understand that perspective as well. The students, I think, have a different area. I've spent time this morning actually over in a sixth form college, and to see all the students, to hear the laughter and the voices because they're together again, you know, that is really important, that as a group we're able to build back quickly so that that social community is rebuilt, and that young people are able to draw strength and experience and share experiences and some joy together. But it's different for the people who are just 2 or 3 years older, because those young people are still stuck in their kitchens and their bedrooms, working from home, not able to watch the behaviours, hear the language, see the clothing, learn from what's going on in the workplace. So, you know, it's not just, oh, young people have this and older people have that and single people have this and families have that. There's all kinds of nuancing within. So for me, the key thing has been around communication and listening far more than telling, listening far more than suggesting, but actually absorbing different perspectives and ensuring that in a big organisation, we have the flexibility to be as supportive and as accommodating as we can be. And so the NCG approach is flexibility. We're not talking about a hybrid working model. We're talking about a flexible working model. So for people who feel better for being in the offices are open. Different working arrangements, social distancing, hot desking, all of that sort of thing, but the office is open. But for those for whom the work-life balance is such that it's brilliant to be in the kitchen, you know, that's fine too, as long as they're able to engage, do their job, feed on the, you know, the input of others. You know, we will support whichever model works, as long as our business is about students and exceptional education. So as long as we are supporting our students and delivering exceptional education, we are very willing to be as flexible as the business allows. I think one of the things that's really important, though, point that's already been mentioned, and that's the language. This is absolutely the generation of change. Our people who are students are coming through to be workers of a new landscape. Our staff have gone from being primarily office or desk-based to being very nomadic, very flexible. And so my view is very, very strongly that we pay 100% respect for the challenges to mental health, wellbeing and fitness, but we also recognise that people have done great things in this year. They've survived, they've been resilient, they've kept going. They have, in the main, looked forward, and we can build back with this rare experience of living through a pandemic. First time I've ever done it, that's for sure. And, you know, use the time to reflect and do things differently and do things better. So let's have language about a new normal and this generation not being lost, but actually piloting what's going to come next.
Fantastic. Thank you, Liz. And again, so much to consider within that. And one of the things we found in our organisation is that working in this way, you know, whether it's via Zoom or Teams or another version of this, is sometimes not picking up on the social cues that you might pick up on if you're in and around people. So not having a real strong sense of where people are at, how they're feeling, how they're getting on, almost that empathy can be harder with this way of working. And therefore us missing opportunities to spot when actually, you know, somebody was having a hard day and we need to get around them. And I still think we've got such a long way to go in this different way of working that you've described so clearly there to best support our people, to best support our students. And I'm really interested later on in the conversation, Liz, to come back to you around sharing of best practice, you know, how you've done it across such a complex business and how you might be able to do that across the wider sector and what we should all be thinking about there. Lachey, I'm really keen to come to you next. Jane talked about young people earlier on, and just to get from your perspective, I believe, are you a current apprentice? I know you're part of the Association of Apprenticeships or Apprentices, and just to get it from your perspective, how have things been for you, and how have things been for other apprentices that you may have spoken to and young people more broadly over this last year?
Well, starting with myself, things have been quite challenging, is a nice term for it. I began my apprenticeship in June of last year. So I found my apprenticeship April, May time and started June of last year. So I started in the pandemic, in the midst of it. Still haven't met my team, I haven't met my boss. Everything's been remote. Also my apprenticeship training, so my actual qualification has also been remote. And to begin with, I was in the mindset of everybody's going through a difficult time at the moment. I just shouldn't feel sorry for myself. I shouldn't feel a bit upset. I should just continue and go forward and be resilient. But you can only be resilient for so long, especially prior to that, I was struggling with my mental health. But I had the drive if I really, really wanted to get into digital marketing. So when I did get the apprenticeship in digital marketing, I was like, I've done it, I've achieved what I wanted to do, so just stay positive. However, getting towards the winter months, it did become very, very challenging. And for me, it was more the lack of socialisation. I was, at that point, I had moved out of my family home. I had, for some personal reasons, I had my own apartment. I was feeling really empowered by it, but at the same time, I didn't have that socialisation that I'd had prior. I was at university before, but left university due to being unhappy with my course. And I thought to myself, I was like, it's fantastic doing this apprenticeship. I'm getting both the qualification, I'm getting hands-on work experience, but I felt I was not getting that socialisation. Sorry, I can't say my words today. Socialisation. And I just kept thinking to myself, what can I do? So I was so happy when I saw the Association of Apprentices, and I thought, let me join this and see what can happen. And I've met so many great people on the association, as well as we look to help apprentices as well as we're kind of a network within ourselves. And that's been really, really good, just to kind of meet other people that are doing the same thing as me. Because one of the things with missing out on the face-to-face aspect of the apprenticeship, I would have been going on my courses. So we do 3-day courses for digital marketing. And I would have been going on my 3-day courses every quarter. And that would have been me travelling to Worcester, going for my week-long session and then coming back. But that was all online. So I didn't get to meet anybody. We obviously were on Zoom together, but no one had their cameras on. It was just a standard learning, do your exam, pass your exam, move on. So the association has been fantastic, but at the same time, I can understand that a lot of apprentices at the moment are struggling with the lack of socialisation, and that was kind of an issue even before the pandemic, because with university, of course, you get your whole cohort, with college, you get your whole cohort, you're always together. But with apprenticeships, it is slightly different. And I think the pandemic has shone a light on that more so, because we really don't have that group of like-minded people doing the same things as us. So that's something that I think can be worked on, whether that's the training providers, whether that's employers trying to get the apprentices together, things like that, I think would be really, really good.
Yeah, fantastic. Thanks, Lachey. And I just want to say congratulations on getting an apprenticeship in a pandemic. You know, that must have been some going. And it's brilliant to see that you're sticking in and enjoying it as well, even though there's been real challenges. One of the comments I heard, it was about a year ago now, somebody said to me, "Oh, don't worry, young people will be fine with all of this remote stuff because it's how they live their lives anyway." But I mean, what do you think about that?
I completely disagree with that. I think people assume that because we spend so much time on our phones and on technology, that's what we're used to. However, I believe anyway, we spend a lot of time socialising in the educational setting, and we've become very familiar with that. We spend pretty much our whole lives in school, and then we either go to college, sixth form, university, apprenticeship. We all do different things, and those things are a part of our lives in a sense. I was saying to a friend, actually, when I was at university was part of my not persona, but it was like a part of me. Like I would say, "Hi, I'm Lachey, I'm a psychology student." That was like my representation. So I think people need to understand that when it comes to education and when it comes to our social lives, we do spend a lot of that face to face, and we do enjoy that. And I think going forward, that there needs to be an emphasis on that, not just using Zoom, using Teams, a face to face workforce, face to face training. All these things, I think, are the things that will help us and continue going forward in a sense with enjoying being together, which we've not had for a long time.
Yeah, fantastic. I hope you'd say something like that, Lachey, because part of what I was thinking, although I didn't know best, and it sounds like, you know, as an apprentice, you've got a really clear view, and that's important. You know, humans are deeply social beings, you know, and this is great, but it's limited, isn't it, in terms of the level of social interaction. So thank you for that very much. And Jill, I'm going to come to you next, just, I suppose, pulling on this apprenticeship thread and the fact that apprentices out in the workplace are quite, I suppose, atomised in some ways. You know, you might have one here, 2 or 3 there, and so could possibly feel a bit disconnected as apprentices, but of course are typically hosted by employers, and massively well supported by great training providers like your training organisation. But how have you found it, and particularly working in sectors that have been so badly affected by the pandemic and by lockdowns? How have you managed, you know, to support your people, support your apprentices? What do you think government should be doing? What do you think providers and we should be doing collectively as we come through the other side of this?
Well, David, I think to say that we work in sectors that have been impacted by COVID, it's no stretch of the imagination. That we're very big in the hospitality sector, and at the other end of the scale, we're very big in care and healthcare. So at one end of our learning spectrum, we've got all of these people who have pretty much been out of work for a year. At the other end of it, we've got people who've been rushed off their feet for a year. So back to that old analogy that you used earlier, we're not all in the same boat, but we're definitely all in the same storm. And we've had to be really flexible around our approach with our learners, but also employers. One of the things that's been really helpful for us as an organisation is that we spent a lot of energy prior to the pandemic, actually, in making sure that all of our staff were not only skilled up in online teaching techniques, so that they didn't just go onto Zoom and have a go. They knew what they were doing in terms of delivering online, and we were able to give our learners that proper learning experience. It's interesting what Lachey says about that kind of being on your own. We've actually found that our learners have joined together better into cohorts whilst we've been online. We have a lot of interactive online workshops that they attend, and they tend to attend them in the same groups. So they have that support of each other. They've set up their own WhatsApp groups. They work really closely together, and we make sure that all of our groups are small. So we wouldn't ever go more than 12 people, just so that everybody fits onto the screen effectively. They can really see each other. I think one of the things that worked for us is that we didn't close at all during the pandemic. So we didn't have all of our staff at work all of the time, but we had all of our staff at work some of the time, and they were able to continue to support the learners that they work with, the individuals, but also the groups. And I think that made a big difference. For the care learners, we've had more care learners who've been on breaks in learning just because of the necessity of it, really. They've been absolutely flat out. The other side of it is with hospitality learners. Surprisingly, we've had almost no one drop out, huge success rates. And those guys have said, well, I'm not doing anything else. I might as well get on with my learning program. I might as well really, really work on my study. So that's been a really, really good thing. I think it's helped us because we haven't got anything other than humans, right? We don't have, in this industry, in education, we don't have a sausage machine. I can't change the formula tomorrow and make a load of cash out of that. All we've got is people. I've got the employers that we work with. We've got the people who work for them, who are our apprentices, and I've got my own staff. That's all I've got. So we have to be really careful to look after them. And I think one of the big changes that we've seen this year, and actually a positive change, is that our businesses we work with are really keen to develop a supportive workplace culture. Many of them have taken this last year to stand back and look at how supportive they are with their own staff, look at how accessible they are to their own staff. By the way, I think that's going to create an issue for some of them, some managing directors who've now set up WhatsApp group with their staff, and how are they going to walk away from that again and put the lines of management in between? That's a whole different story, isn't it? But I do think, I think a lot of people have made that investment. As I mentioned in the intro, we've done over 1,000 first aid for mental health courses for our employers this year, and people are just raising their understanding, and I think that's a really big part of responding to the current challenges.
Fantastic, Jill. And I mean, again, lots in there. One of the things that popped out to me is I feel over the last year, me and our organisation were learning constantly about how to adapt. It just doesn't stand still, does it? Because the phases keep changing. You realise actually that we can't apply the logic to this situation because the world keeps changing. And particularly about, there's one example that pops into my head, Teams or Zoom fatigue. Do you know that the people hopping on and being on 10 hours of meetings straight, and was thinking, oh wow, productivity's gone through the roof, that's great. And then suddenly you realise people are completely burned out. Somebody said to me a few months back, David, it's about 3 or 4 months since anybody asked me how I was in a meeting. That used to be normal. Do you know, we'd have the social, we'd have the chat, we'd be waiting outside a meeting room, we'd be making a coffee before we went in, and we just had that, and nobody's asked me how I am. And it's like a moment of this new way of working, the same old logic doesn't work anymore, does it? And for the sectors you work in as well, I imagine there's real challenges there, getting open, getting productive, but keeping people up and, vibrant. And
yeah, I think a lot of our clients, I was talking to the HR director from a large hospitality group the other week, and they were saying that they actually, first of all, don't know how many staff they've got at the moment, because they know how many are on their payroll. But when furlough comes to an end, or when they start to reopen properly and they try to bring people back, they kind of don't know the size of their problem. They're kind of thinking that current absences and losses from people being unwell or mentally unwell and unable to attend work, that's kind of been hidden by furlough, and they don't really know yet kind of where they are. So I think we've got an emerging issue here on top of what we know already, there's a whole emerging picture that remains to be seen.
Yeah, absolutely. And that point around uncertainty, there was a study that I read up on, a UCL study, that proved that humans would rather know they were definitely getting an electric shock as opposed to they may or may not get one, because it was the uncertainty factor was more frightening and more stressful, and genuinely more stressful than knowing that you would get a shock, even though it was the same shock that you may or may not get if you were in the other group. And that really hit home to me, because there's been so much uncertainty in the world. How, as we come through this, do we get levels of certainty and assurance for people where we live in a world that is uncertain, it's volatile, it's unpredictable? So I'm going to come to Janet next, and I'm really interested, Janet, from your perspective, you know, as you see things, but then particularly thinking about progression to education, you know, how that might have been impacted. We're hearing about Kevin Collins focusing on catch up and what that might mean. I've a few times found myself talking about a lockdown hangover, and literally probably a hangover because I probably drank far too much during lockdown, like lots of people, but also this hangover for education. How do we wash that through the system? What are your views on that?
Yeah, thanks, David. It's not easy, is it? So obviously, because I work in an FE college and as part of a union that covers higher education, I think it comes back to language for a starting point. So, you know, we've already talked about this kind of problematic language. I think just the idea of having to catch up, it's kind of, we'll catch up with what and to what level, and, you know, how that's going to work differently for everybody. And I do think that something that isn't talked about enough is that there's been lots of really high quality teaching and learning that's been happening online. I like to think that I've been putting extra, you know, kind of focus on making things interesting and making them accessible and finding ways for people to talk to each other and students to kind of, because we do short courses, so a bit like it's been said already, they're not going to, it might be a 10-week course, so they'll never, you know, meet each other in person if they're just doing it online. You know, and lots of the support that's happened in FE and HE from kind of, you know, support workers, etc., has again been really high quality in lots of instances. So I think we do need to move away from online learning is bad, classroom learning is good, because I think it's a much more complex picture than that. In terms of transition, you know, from FE to HE, for example, clearly it's an incredibly challenging time for university students. You know, I don't know about you, I wouldn't want to be going to university right now because of the things that you would be missing out on in terms of, you know, the other things that you go to university for. You know, I wouldn't mention drinking, obviously, but you know, the whole social aspect and just kind of meeting with other people from different places and that kind of stuff. So we know that students have been massively struggling, you know, with their mental health, and there have been suicides, and we don't always know that there are suicides. Of course, there was a particular case of a student at the University of Manchester. I live in Manchester, and that's my old university as well. And you know, it's absolutely horrendous, this loneliness situation that we've got, even for a starting point. You know, I don't think, you mentioned it earlier, this idea, this kind of, that young people just bounce back, like, you know, they'll be all right, a bit like little kids when they just kind of get up and carry on. It's not like if you're at university for the first time and living away from home for the first time and in a strange city, you know, in the middle of a pandemic. Yeah, I think that's going to have a massive impact on people's mental health. And the only other thing that I would say on that really is that you know, students need their staff, their lecturers and their support staff to be well as well, yeah, as mentally well. And I do think that sometimes there's a bit of a kind of crossover in terms of mental health support for staff versus mental health support for students. And I think there should be a very clear you know, separation between that, because it's a completely different set of support services. And you know, I worked in a different FE college before, and we had some training from someone, and they were brilliant, you know, but the brief they'd been given was general. So the way they were talking about it was supposed to be about mental health support, and it turned out kind of half being about students and half about staff, and you came away feeling a little bit empty. So I know I've gone off on a little bit of a tangent there, but you know, I do think that that's something that needs to be clear, that, you know, when we're talking about students, we're talking about students, but we're not forgetting about the workers in these situations also.
No, it's really important point, Janet, and absolutely don't mind the tangents at all. I think that's what makes for a really rich and interesting conversation. Anna, I'm going to come to you next, if that's okay. Over the years, I've often looked at your work and the work of your organisation and about it, spotlighting best practice, particularly in apprenticeships, of course. But are there any examples of where you've seen great things going on, either in your organisation or more broadly, both in terms of how we've dealt with the last year, but then things that are going to be really important going forward around best practice, how we best support learners, and to Janet's point, how we best support our people as well?
Yeah, definitely. Thank you, David. I'm a massive supporter of trying to shine more spotlights on the brilliant work of our sector, because I think so often those stories aren't elevated and shared. So if I give a bit of background, it will explain where it's come from. Early on in the pandemic, we were working with groups of training providers. I manage the Beds, Herts and Milton Keynes provider network, and we were already working with training providers around the mental health and wellbeing agenda, and had engaged with an organisation called Gen Healthy Minds, and we were kind of looking at a programme that we could put together. That was a few months before the pandemic. And so when that came about, already we had that group in place saying, Anna, we need to do something. And so talking to Mike, it was like, actually, this shouldn't just be a Beds, Herts and Milton Keynes thing. We need to take this wider. This is a national challenge. So we started, and engaging with AELP as well, we started to put together a series of workshops to really support training provider staff who were trying to, in their roles, support apprentices and employers. And the feedback that we were getting was that, everyone was trying to deal with their own challenges, as well as then carrying the weight of really apprentices who were finding themselves in some really challenging situations, and employers as well. So we put together this series of workshops, and very naturally it started to come through that actually there was so much good practice happening out there. There were so many initiatives that people had already started implementing with their learners and with their employers. Or they were hearing about, all of those kind of fitness campaigns and different activities and challenges that were going on, and people started to share. But they were sharing how they were implementing them to successfully support apprentices, staff and colleagues and employers as well. And so typical me, I thought this is all too good to kind of keep to ourselves. We need to put this together and pull it together into a guide. So we created this booklet, and it's free to download on our website, and it's kind of 50 apprenticeship activities that you can do to support the sector. And there were all sorts of things coming through. Some of them where they taken in-person activities, like there was one that sticks in my mind called Sparkle Moments, which was identifying and just taking a moment to spot where apprentices and learners were doing something brilliant, making sure that you recognise that. Some of them were slightly new, and Nick, I wonder how this is linked to your organisation, but FIKA moments, where staff were encouraged to just take a break, go and get something nice to eat, grab a cup of coffee and go and do something completely non-work related and just talk to each other. And we found through all of that sharing of best practice that there was this brilliant community of like-minded individuals who found that they needed it for themselves. All of the resources, they were saying, can I share this with my brother, or can I share this with my colleagues? And it went kind of all over internationally as well. But apprentices started to get involved as well. So we found that training provider staff were actually saying, these workshops are really useful, can I share them with our apprentices? And the feedback we were getting there is about equipping them with some of the techniques for, I suppose, building their confidence, building their resilience, and helping them to understand and make sense of some of those feelings and thoughts and emotions, and really making it a safe place where they could share some of those experiences, but we could give them some ways to help them as well. And so that's been really successful, and something that we've carried on, because I know we keep talking about this storm and the boats, and it feels like the storm keeps changing, and depending on which sector you're in and your personal circumstances, you may be deeper in that storm or somewhere where there's a glimmer of sunlight coming through. And so trying to keep this really flexible approach, I think, is really important. I'd just like to flag up, kind of building on Lachey's experience of being a new apprentice and being onboarded. I think we've got to be careful to recognise all of the differences with our apprentices. We've got some apprentices who will be adults and perhaps feeling a bit better equipped with some of this. We'll have apprentices who will be young people and will have had their own challenges in that respect. And we've also got new apprentices coming through. And we're hearing from employers, you know, some concerns around how you know, you don't just come in and say, do you have a mental health problem? It's so much more complex than that. And I think we all are understanding that, but therefore the kind of support that you put in place needs to be very kind of tailored and personalised as well. But how those anxieties may be coming through as kind of being demonstrated by those individuals are around perhaps lack of attention or attention to detail, less focus on tasks perhaps, and that feeling of disconnection from the team. And I think we've got to be really mindful of also supporting new apprentices coming in, as well as the apprentices who are on programme and are facing challenges around being reboarded to the workplace and reboarded to their apprenticeship programmes as well. And then all of those people providing that support around them.
Fantastic, Anna, thank you. And do you know, it's sometimes it's the smallest things that can make the biggest difference, isn't it? And I know that's a bit cliche, but it's really true. And when you talked about FIKA there, and Nick knows the meaning of FIKA better than anyone, I think. And the thing that stuck in my mind was the coffee in the sweet bun. And I thought, you know, I haven't had anyone bring me a cake for over a year. And very genuinely, do you know, that's a lovely thing when you're in an office when somebody does that. And it's those tiny little things that just keep you going when it's tough. And we just don't have them in the same way. Just on that, Nick, do you want to come in quickly on that? Any points there?
Oh, well, thank you, David, and just very briefly, and thank you, Anna, for mentioning the FIKA moment. It's really interesting, and you know, really lots of respect for the work you're doing, and actually shining the light on positive moments is really important. We talk a lot about techniques as well, and that idea, you know, the FIKA idea and the concept is about taking time for yourself and each other, and it's really about that. You know, for us, there's a huge lack of self-care. People are too busy to take time for themselves. People are too busy to look after themselves. And that means if you're not busy looking after yourself, you're not in a good position to look after each other. And so that concept of FIKA is really at the heart of what we've built. And it's a five minute exercise format delivered through a number of courses, all with multiple 5-minute exercises. And in each 5-minute exercise, there's a tip or a technique taught that you can then repeat. And it's exactly in that format of, look, there are lots of tips and techniques like positivity techniques that you can practice, or gratitude, or listening better. There's lots of techniques that we just don't get taught, that we can practice on our own and practice with each other. And it's that little give up time yourself that makes you better for your community and more outward and more able to be mentally fit and performing well for each other.
Brilliant. Thank you for that, Nick. Okay, so I'm just going to go to Lachey now. Just Lachey, one question that I'd like to pose to you before we finish up today. So as an apprentice, you know, as somebody who has joined an apprenticeship program in the midst of a pandemic, and it sounds like you're doing really well, but have faced some real challenges, engaged on the program. Is the one thing that you would say to government or to stakeholders or to our audience today that is a recommendation from an apprentice's perspective of what we could do differently or better or more of? You know, one thing that you would say is really important to you?
First of all, for government, I know this has been constantly, wouldn't say protested, but constantly spoken about for the last few years. But the apprenticeship pay, I think, is a very important aspect of something similar to what Anna said about apprentices are all very different. You've got apprentices that are mothers or fathers of 3, you've got apprentices that are school leavers, you've got so many different kinds of apprentices. And I think what's really difficult for some apprentices, or those who would like to go into a new field, they're put off because they know that they can't live on that wage. The wage is actually lower than what I used to get when I got my first job when I was 16, working in a cafe. And that was meagre. My little sister actually said to me, my sister's 10, she said that she gets paid more to do her chores than what I get paid to do my apprenticeship. So it is very, very poor. And I know that some employers do pay the living wage. However, in my case, that's not, unfortunately, I don't get paid that. I get paid the minimum apprenticeship wage. And that was a problem for me when looking for housing, when budgeting. I mean, I guess it has taught me to budget very, very stringently. But at the same time, I just don't feel that it is fair. I'm currently working harder than I was working whilst I was at university, doing a psychology degree. I'm working 9 to 5, sometimes ends up being 9 to 6, 9 to 7, doing my job. Then I'm also preparing my apprenticeship work, my portfolio, revising for exams. I'm working very, very hard. And for someone that has struggled with mental health, and I've also struggled in a sense with boundaries, with separating work and home, and separating work and home whilst working from home is very difficult. So that's one thing for governments, I would say, is pay, because ultimately finance can have a big effect on your day-to-day life, which then therefore will affect your mental health and physical health. To the point where I know, I won't say any names, but an apprentice that I'm familiar with was being paid so low, hadn't had to buy a prescription and didn't want to buy the prescription because they knew they couldn't afford it because they wanted to eat. And I just thought to myself, this is this is the kind of thing you hear about in like America when people don't have insurance and things. I was like, that's so bad, and that really shouldn't be the case. So that's one thing. And then on the other hand of that, kind of where apprenticeships stand in society, and I know this isn't specifically for governments, this is just in general. I would really love for apprenticeships to be seen in the same regard as university degrees, because the skills I have learned in the last year are immeasurable in comparison to studying university, doing my A-levels. I've just learned so much, both professionally, academically. Really and truly, I really do appreciate the apprenticeship. Of course, I've had to weigh it up with not earning so much, but it really has equipped me for the workplace more so than I think school and other education settings have. So that's one thing I would think it's important for employers, for kind of all aspects of society, to see apprenticeships as really beneficial and as beneficial as going to university, because a lot of people, I've had family members even say, oh, you're doing an apprenticeship, like, oh, I thought you were at university, why would you kind of in a sense go down a step on the ladder? And I feel I've gone up several steps, and when now looking to do job applications for new employers, I have a lot of the skills that people with a marketing degree don't have, because I've had a year of working hands-on with clients, and clients from Australia, New Zealand, different places, whereas other people haven't had that. So in conclusion, apprenticeship pay and apprenticeship standing in society, and how important it is and how much it can open doors for young people.
Lachey, do you know what? They're incredibly powerful words that you just shared with us there. So I really appreciate that, and your honesty and openness around that as well. And I'm sure there's lots of apprentices in similar situations, you know, maybe different in some ways, but similar situations. And so I really hope, you know, our audience, you know, takes that on board. And one of the things that really strikes me about what you've said is this reward and recognition. Yes, partly it's about pay, but it's partly about, you know, esteem and self-efficacy. And, you know, if society doesn't think that what you're doing is absolutely admirable, that's hard to take. It sounds like it's really hard to take. So for what it's worth, you know, it sounds like you're doing a brilliant job. Stick in, you know, you're going to do well, I've got no doubt. Thank you for that. So now I'm going to come to Paul and to Jane to do a bit of an AELP double act, if that's okay. So however you do this, over to you guys. But I'm really interested, you get to see right across a diverse range of training organisations, delivering lots of different types of provision. You'll have seen all sorts of great stuff, you'll have seen all sorts of challenges there. And what I'm really interested in is, from a government perspective, a policy perspective, a funding perspective, these organisations, I'm aware, are under some real challenges to, you know, to keep the doors open, to serve learners, to keep doing the great work that they do. So what are your views in terms of where we're at from a policy perspective, from a funding perspective? What are the good things that you're seeing? What would your recommendations be to government, to stakeholders? Have you got any advice for, you know, panel members and our audience today?
Thanks, David. And if I just kick off, and then I'll pass the trickier bit to Paul on the policy side. But just a couple of reflections, really. And one of the things that I thought about in coming to this roundtable was, and it reflects what Anna has been saying and what Nick has been saying, and it's about how we look after ourselves. and it's about the impact that this pandemic has had on the workforce in the FE sector. So, you know, learners we'll come to in a minute, but actually we are the people who are trying to solve problems, and the way in which we look after ourselves has been pretty poor. And in my experience, because we're trying to do so much. And I had a situation a couple of months ago with my daughter where she said to me, would you stop complaining about being on Zoom all day long? She had one day at university where she had to go from one lecture to another on screen, and she cried. And she just, because it's unnatural. It's not a way of doing things. And what we do is we jump from one meeting to another without taking, you know, we can come to the end of a day without having eaten. And as Nick said, if we're not looking after ourselves, then how can we look after other people? So that's just an observation. And I think, in spite of the fact that young people are seen to be on technology so much, I don't necessarily think that all of them can adjust to this way of learning. So what I'm hoping for, and in going forward with AELP and providing the service that we do to members, I would absolutely die inside if we did everything online. I just, you know, I cannot wait for us to be in a place where we can have a cup of coffee and say, how are you? And, you know, I can buy you a cake. So it's that would be just, those are just some observations. I think the language that we've used in this has been really interesting as well. We talk about storms and loneliness and lockdown guilt. I think we've all felt the same thing. In terms of AELP, what we did at the outset, I mean, we all thought we were going into the lockdown for, you know, a couple of weeks, and we didn't realize that this was going to go on for quite some time. And I suppose putting a different spin on it, what I've seen from the AELP membership, which we thought that we would lose 30% of our members over the period. We've lost 24 members in total. So we brought everybody together. So we opened up all of the services to non-members as well as members. We asked for the permission of the membership to do that. We brought people together to talk about what the issues were. And actually, I think all of us on this meeting would recognise that independent training providers were facing a particular hammering from the government without the kind of support that was available there for colleges. So we had the whole provider relief, the absence of that for providers. So there were battles on every front. And we got to the point, actually, so we were holding weekly meetings for non-members, and we got to the point where we had to buy new licenses for everything because of the numbers of people who were joining our meetings. So we were hitting over 1,000 coming to one meeting, and we didn't have the online capability for that. So we had to invest in that. I think that, you know, not to underestimate the fact of the pressures that have been on independent training providers in particular, with having to furlough. We all know that the whole functional skills issue is very well documented around the support to learners, and what providers have been trying to do is to support learners without adequate government support. It just hasn't been there, but the resilience has been extraordinary. And I do think that coming together and that period of time when we spent bringing everybody together, you know, we couldn't see everybody because we had hundreds of people on screen, but just to share what the problems were, what the solutions might be, I think contributed to well-being and to people feeling that they weren't kind of sailing their ship alone and in the storm on their own. So I think those are the key points. To touch on policy issues, and Paul will go into this in more detail. The point that Lachey makes, obviously, AELP campaigns for apprenticeship wages and that they are improved, and we campaign for the status of apprenticeships in our society. But we also, the areas going forward, I think, which really need to be looked at are catch-up funding, because we have so many learners who are in lost learning, and actually for their well-being, what they need is to have that sense of achievement. And we're currently in a situation where that catch-up funding is not going to be available for providers. We need to address that, and we need to campaign for that not to be the case. So catch-up funding would be the one thing. And I think I've said this before, I think just being kind and actually recognizing that people have gone through, people have gone through an extraordinary difficult time. Let us recognize what learners have been through and just be kind and allow for those flexibilities, which point I'm going to pass to Paul now to do the tricky policy bit.
Thank you, Jane. I'd like to actually go back right to the very beginning of this conversation, actually, and something, almost the first sentence that Nick said, which was, I didn't write it down verbatim, but it was along the lines of that the pandemic has forced a period of reflection on everybody. And I think in terms of policy, actually, you can only really formulate any policy if you're actually really clear what the issue is that you're actually trying to address. One of the great uncertainties about COVID as an illness was the fact that there was absolutely no way of knowing in advance how it would affect you. Potentially, you could get it and not much would happen, or you could get it and feel a bit rough, or you could get it and end up being seriously ill and going to hospital, or you could get it and end up passing away. But there was no way in advance of knowing how that was going to happen. And you sort of had to be ready for every contingency. And that uncertainty is what fed a little bit of the panic and the tension in society in general. Now, that's very much, I think the same principle applies to mental health as well, because actually looking back on it in that period of reflection that Nick has talked about, this is a little bit of a personal opinion, but I think we tended to lump mental health issues almost in one big box somewhere. There are some mental health issues here and we will dip into a toolbox and we will address them. And actually what's happened is that we've suddenly realized, this has made us reflect on the fact that mental health in particular is an extremely diverse and very nuanced collection of issues that it was not immediately obvious, and we certainly were a little complacent perhaps in looking at them before and saying what they were about. And suddenly everything was different. Some of the learners that were doing all right suddenly weren't. Some of the ones that weren't doing all right suddenly are. I've heard stories of, particularly, for example, autistic learners who thought online learning was absolutely brilliant. And they are actually now getting very stressed by the idea of going back to face because that interpersonal connection was the bit that was holding them back, and they've been flying during the pandemic. So trying to get your head around that sometimes is, oh, hang on, we've got to try and deal with that as well. And none of this is over yet. You know, we're only at the beginning. It was in the FE Week supplement, I think. We're only at the beginning of the economic emergency. And we may see redundancies and the economic impact compound and exaggerate these mental health effects even further in ways that we're not quite ready for yet, or that we haven't quite anticipated. So in terms of policies, it's, of course, we can all say things like, well, you know, there should be more money, somebody should do something, there should be more support from government, but we do need to be much, much clearer about what the issues are that we are actually seeking to address, and making sure that we're applying them to the right people. So I actually think underlying any policy response, there is an onus actually on our sector to be very clear about making sure that we can properly articulate what those issues are and who they apply to. And I think we've got a little bit of a way to go on that yet. And before we can properly expect the government to come back with a set of policies that address what we need to happen, because I'm not entirely clear that we're quite sure what it is we're dealing with yet. And I think that's a real imperative at the moment.
Yeah, fantastic, Paul, and Jane for your wise words as well. Again, all sorts in there. Just a couple of things to pick up for me. There's so much reform going on in the sector, some of which started well before the pandemic, some of which has actually kicked off during the pandemic. And it's to your point, Paul, we're reforming for a world that we don't yet fully understand. And one of my points that I make to anyone who will listen really is that, you know, in an uncertain world, we've got to find areas where there is stability. We have to find, you know, systemic stabilities, you know, organizational stabilities, and most importantly, stability for our people and our learners. And in a really volatile and unpredictable world, that's tough. So are some of the programs of reform an opportunity to take a breath, take a moment and think, actually, is this what we need to do right now? Because we're moving into a world that we ill understand. And one of the other points around that for me as well is that I often find myself talking about the low trust paradigm that we operate in education. Do you know, we as an awarding organisation check providers are checked by ESFA, they're checked by Ofsted, they're checked by, you know, there's checkers who check the checkers who check the checkers. And that just frankly to me seems bonkers. Do you know, as a leader in an organisation, I know what happens in my business if we operate on a low trust paradigm. We end up with a corrosive culture. So how do we think that's appropriate for a system? and I'm really sorry because I know it's quite controversial. I just think we've got it wrong. So what can we learn from this last year to move to a higher state of trust? Because for self-efficacy of organisations and people, we need more trust in the world, is my personal view. And it's to your points there, Paul, which were really, really well made. There's just, I'm going to come to you next, Jill, if that's okay. One point that I think is really interesting is around safeguarding, and how safeguarding, you know, the point that Paul made around learners with autism that suddenly are in a home environment, that might have got really uncomfortable for a provider to think, well, how do we safeguard these learners that have complex needs, for example, if we can't physically see them? But that's just made me think about safeguarding more broadly. So what's your experience and expertise around this? You know, things that you might have done to apply safeguarding really well in this new context that we're working in?
Well, David, we've had a safeguarding officer for as long as I can remember, actually, and frankly, she was relatively untested until this last 12 months. We used to get a safeguarding issue, and it could be anything, frankly, from somebody prevent measures that needed to be enacted, all the way through to somebody who was perhaps very lonely and isolated and needed that support. In the last year, we've had to make our safeguarding officer full-time, a full-time permanent position, because the number of referrals we're getting is higher and higher. And I guess you could say to some extent that is because our staff are much better skilled now at identifying early on, to Nick and Jane's points, really, identifying early on some of those red, you know, those little red buttons that go off and you think, hang on a minute. Is there a challenge here? Are they in a difficult position? Is there something wrong at home? You know, getting to know those learners, being able to support that. There might have been more referrals because of that, but I think there's been a genuine and significant increase in the number of people who have been isolated, been in difficult positions, found themselves feeling suicidal, being locked up in an unsafe environment where they could feel unable to be able to get out, really. And that's happened for a lot of our learners. I mean, the support we've been able to offer, obviously we have the safeguarding officer, and she will take whatever is the right pathway for those people. We've got 3 designated first aid for mental health officers within the organisation as well, and they support both staff and learners. And we also have a counselling support service that we pay for all of our learners and all of our staff, so that they've got access to those sort of things. And I think one of the things that has paid back dividends for us is that training that we gave out all of our staff to make sure that they could not only look after each other, which is really important. You know, if people are coming to the meeting but they never have their camera on, they don't speak, that kind of thing. You know, people aren't engaging. They can look after each other, but can look after the learners as well. And I think that's been really important. If I can just quickly go to to Jane's point earlier around this catch-up funding. We're at a position at the moment where over 20% of our learners are out of funding. We've got no funding left to be able to support them. But because we're the organisation we don't stop working with those people. We do continue to support them, and it would be really helpful if the government could help us with that.
That's fantastic. Thank you for sharing that, Jill. And I think it's admirable that, you know, organisations like yours are making that investment, but it does come at an additional cost, and that needs to be recognised. So I think you're absolutely right. Liz, I'm interested to hear from you from a college perspective. You know, we've heard what I think sounds like great practice there from Jill. What about in a college context? Have you got any little nuggets for in terms of best practice that you'd like to share with us?
Yeah, and this has been so fascinating because I think we're all dancing around the same themes, just coming at it from very many different perspectives, which is very reassuring. So I guess from a college perspective, there are 2 sides of the sort of debate. One is recognising the levels of anxiety, uncertainty, discomfort with change, and what the future is going to look like. They're the negative things. The positive things and the best practice that we've tried very hard to put into place has been around leadership development, the development of trust, and the phrase that you use, the low trust paradigm, is something that we would want to absolutely bust. Boundaries, support, and kindness. And somewhere in all of that, I wanted to add in something around presenteeism and fatigue. And so if I can just run through those things sort of very quickly, because other people have got other stuff to add. For me, the best thing that we've done is shift the mindset of both the staff, but also the managers. So in terms of the staff, I've wanted to shift the mindset away from being anxious. And what we have done is put out a really strong narrative, which is FE's got an awful lot that it has to face up to as a challenge. But actually, this is our moment. We have got to be part of the build back. We have got to be part of tackling economic recovery. We are going to be at the heart of our communities, making a positive difference in a post-COVID and indeed a post-Brexit world. So this is our time. So number one, don't be worrying about your jobs. And number two, don't be worrying about your income, because the staff that had to be furloughed, we topped up to 100% of income because we're publicly funded. Why would we not do that? So take away that initial anxiety about, can I afford my bills? And am I going to be able to afford my bills in the future? And that's one sort of building block put back in. Now, the way we've dealt with the uncertainty and the change, which I have found personally extremely painful, is I have made a video with my iPhone and my laptop in my kitchen, usually battling the dog, chasing cans around the kitchen. But, you know, to talk to people and not to do corporate speak, but to say, this has been a really bad week. This has been a really bad week for me because of this, and this. But it's been a really good week because we've been able to do that, and that. And I've encouraged people to email back to me, or to email to their managers, or to talk to their managers about any of the issues that we've raised. And by keeping that really close temperature check on the things that are of concern, those weekly or fortnightly or monthly videos have tackled the issues that we have known have been causing uncertainty or anxiety. And one of the issues that we've absolutely addressed, that I've spoken about in these videos, is the issue of boundary. If you're working in your kitchen or your spare bedroom or your office in the garden, it's really hard to say, I'm stopping now, or I've had enough of this, my eyes are tired, my head is aching, I'm going to go for a walk. But actually, I'm going to come back to this at 6 o'clock and I'm going to do another half an hour. And that notion that because we are all being flexible means that you can be flexible, I can be flexible, to make sure that I can continue to be productive and feel well. That is allowed. And that's only endorsed and allowed when we have managers who are confident in their leadership to be supportive and to be kind. And the notion of nearby leadership and sharing anxieties, but also sharing successes, so that we have that cultural mindset shift going right across the organisation, has been really, really important. I'm going to close my bit on just the notion of presenteeism. We've got managers, I know, all across the country who think that you cannot be working properly if you're not in the office. So presenteeism is really important. Well, we know that that's just rubbish. We know that presenteeism is incidental because there are many ways of being present. But my personal experience is I had, before it was turned into hot desking space, lovely office in Newcastle, lovely headquarters for NCG, supporting all of our colleges. But what we have proved is we don't need that. We can invest the money that we spend on our head office and on our nice offices back into students and back into staff. Because actually, I can be significantly more present in London, in the West Midlands, in the Northwest and the Northeast, without moving more than 6 feet from my kettle. So I'm saving my travel, I'm saving my time, and I'm saving on accommodation. And more than that, I can be in 6 different locations in one day. And if I can do it, so can my managers. So can, we can ripple out that presenteeism actually means being present when you're needed. It doesn't mean that you have to be either on the side of a screen or in the office. So that notion of flexibility with empathetic, supportive, listening leadership, with leadership that's flexible and confident that we can get through this because we will be part of the solution. For me, that's underpinned whatever practice, whether it's been good practice, best practice, or not very good practice that needs to be improved, but that's what's underpinned it.
That's brilliant. Thank you for that, Liz. And I think to hear that from a leader of such a large, complex organisation, hopefully that gives people some guidance and almost permission, in inverted commas, to work like that, not just in your organisation, but more broadly. One of the points that jumps out for me is that I've had feedback that people feel that I'm more accessible because I'm there speaking to people more regularly, and a little snippets of feedback, which have been quite humbling, really. Around we realise you're a normal person now. Do you know, your son's shouting, "Daddy, I've finished having in the middle of a bloody meeting." Do you know, it's like we're all just normal people, aren't we? And I just think that accessibility, that real almost humanity, if you like, and being able to get around. And so there are definitely benefits and there are definitely positives. You know, the environmental footprint that you touched on. We don't have to be driving about. It's not good for the environment or for us. So lots to take away there, Liz. Thank you.
David,
sorry, go on, Liz.
No, not at all. Just to come back on a point that you've just made, which is really important. You have become more accessible, as I have become more accessible, because I can actually have a 10-minute call with anybody in NCG on Teams in a way that I could never have had if they had to navigate their way through my PA, get to my office, find a space. 10 minutes, 9 o'clock this morning, I had a chat with our head of security because there was a particular issue. Over and done. But he felt that I was accessible to him in just the way that you've described, and we've got to keep that going.
Yeah, no, it's a really, really good point. Thank you for that. So I'm going to go to Jane C and Nick now, if that's okay. We touched earlier on in the conversation around prevention. So this is a theme that I'm really keen to just touch on as we get towards the end of the roundtable. And then after that, what I'm going to go for is a quick fire round, if that's okay. I'm going to go Jane Hickie first up, and in the quick fire round, I'm just looking for 1 or 2 key points that you think are priorities that you want to finish on. Do you know, whether that's for government, for stakeholders, for this group, for the people that hopefully are tuning in and listening to the roundtable today. But firstly, I'll come to Jane first, and then Nick, all around prevention. Given the fact that I think we've acknowledged that operating a deficit culture where support and services kicks in at the point of crisis is not an acceptable place to be. So what can we do around prevention? Over to you.
Thank you. It's huge. The subject's huge, but so I'm just going to kind of narrow it down to make 3 key points. And the third one I'd like to be an example of prevention in practice. So the first point I would like to make is a big picture point, which is to do with the wider context of mental health issues generally. And this does sit within a kind of broader social context. And one of the biggest correlations with poor mental health is inequality in society. So I know that this is beyond the remit of what we can deal with here, but I think it's really important to say that we're trying to kind of plug a hole in the dam. If we see increasing levels of inequality in society, we will see increasing problems with mental health. So that's the first point. There are some kind of more middle range things that I think are important to say that we can do from a prevention point of view, which is we think all education providers should be required to have a whole school, whole college mental health, trauma-informed mental health approach. Trauma-informed itself can sound a little bit technical and frightening, but it actually means, when you strip it down, understanding that the way people behave isn't always as a result of poor behaviour. It's often a result of distress that's being acted out, and we need educators to understand that that's the case. We also think that there needs to be much more early support for young people to be able to access some support if they do go beyond, if they do start to have additional needs, and that should be accessible through their educational provider. I worked for 6 years in CAMS. I'm a psychotherapist myself, and I see the level of distress that you experience in young people and their families when things are allowed to go to the point of crisis, and we shouldn't have that. There should be much better provision available within educational provision. I'd like to give an example of another thing that I think is important around prevention. We know there are real hotspots or risk factors around certain things, such as transitions. For all of us, when we're going through a transition in life, such as for young people, we're thinking about them leaving school, going on to college, going on to university. This is a huge amount of pressure on them. And it's often at that point that a mental health crisis might appear. We're doing a really nice piece of work at the moment, funded by the Office for Students in collaboration. This is an HE example, but I think it's equally applicable from an FE point of view. We're working in partnership with the University of Sussex to work directly with young people to co-produce a series of literacy workshops, mental health literacy workshops, and we're harnessing the importance of young people's relationship with other young people. So this is 5 workshops. It's building on an approach we've used very successfully in secondary schools. It's young people delivering to other young people. And this has all been designed by young people around themes that they feel is important to them when they go off to university, around how to manage financial pressures, social pressures, academic pressures, etc. I think a very similar thing can be done at FE, for example, and this is an example of us doing something at the point of transition without requiring the young person to be in crisis. And as I say, harnessing that power of peer-to-peer support relationship, which also then has a really positive impact on issues such as social exclusion, feelings of loneliness, etc. So there's an awful lot around the area of prevention, but I wanted to just kind of make 3 points really with one very concrete example. Yeah.
Fantastic. Thanks, Jane. Can I come to you, Nick?
Yeah, thank you, David. And yeah, I echo a lot of what Jane put forward there, that prevention is massively overlooked. And I think I'm going to answer it in a very brief sentence, and then I'm going to come to something a bit more detailed. Prevention. Is education the sustainable answer to prevention? And what I mean by that is I want to first highlight a tragedy in mental health, I'm going to use the word mental help, because we often look at mental health as an area for help with our problems. I'm going to use that term, mental health. The tragedy of mental help is that it only reaches the few. Now that's terrible, because the services that we have are there for everybody, but they don't reach everybody. And if we look at the Office of National Students survey that it did around the beginning of the first lockdown and pandemic, 57% of students recognise that their conditions of mental health had worsened, and yet only 29% of them asked for help, went for help. So that tells us we have a real problem, that mental health and health support only reaches the few. So there's also recognised statements such as I'm not represented. So certain ethnic groups don't feel represented by health support or wellbeing, so therefore don't go. Or I don't have a problem. So where in that case does our duty of care sit? Prevention and safeguarding, where does it sit? Traditional services kick in, let's call it day 42 in 6 weeks, when a problem is potentially manifested. So that is potentially late, and also it's only reaching the few. So what's the answer? If we have duty of care over a whole population, I want to propose a different terminology for duty of care. Day 1 duty of care. How about we think of the education gap, the mental education gap that we have in our country, and think of things like productivity, motivation, all of the key skills which we know can be taught, which are embedded into our curriculum at FIKA. Why don't we think of day 1 duty of care and bringing mental education formally into curriculum, and recognizing that something like confidence is as important as maths and English. It is, it completely is, and it's needed. And if it's taught, then guess what? If it's mandated, guess what? It's not for the few, it's for everyone. Mental education and fitness should be for everyone. It shouldn't just be for the few. And that's what we feel about prevention. And I know, David, from NCFE's point of view, I know that you guys feel the same as well. And that's why our partnership, and to end, my end point really is to reaching out to FE centres across the country and to say, do get in touch with FIKA or NCFE, because we are trying to help with that right now.
Brilliant. Thank you, Nick. Okay, so I'm now going to wrap up today's roundtable, which is at risk of going on for hours and hours, because I find this topic so interesting and so important, and really interesting to hear the views from all of the guests, all of the panelists today. So Jane, I'm going to come to you first in the quick fire round, if that's okay. Any 1 or 2 things that you would say, whether that's to government, stakeholders, or the sector more broadly, in terms of priorities as we come out of the pandemic?
Yeah, so I suppose if just looking back at if we look back at the definition of mental health, and that it is about a state of well-being in which an individual can realize their potential, they can feel, realize their abilities, they can cope with normal stresses, and they can feel like they're making a contribution to communities. My plea would be that the government works with providers and across the sector, across the whole of the sector, to allow for learners who currently are in a place where they feel that they may not be able to realise their potential because they have been held up, because of lost learning, to work with us, allow for those people to be productive and to make their contribution to the community.
Okay, fantastic. Thank you, Jane. I'll go to Janet next, please.
Thanks. Yeah, just two things which do kind of echo what Caro was saying before. Training. So, especially for kind of middle managers that might be line managing people, mental health first aid is fantastic. I'm an instructor for it, but I think that could be for other staff, because people need somebody else that they can go to that's not a manager or an HR person to talk. And stress risk assessment training for managers, dealing with health and safety legislation, dealing with the Equality Act, knowing how reasonable adjustments work, these kinds of things. And then the other side, of course, the prevention side, we need more funding. We need to work together on this. We need to ease workloads, especially admin burden on staff. We need more funding for proper mental health support for staff and for students, and that would make everybody's lives a lot easier.
Fantastic. Thank you, Janet. And I can't resist the alliteration of going to Jill next. So 3 J's in a row.
Okay, well, I would start with, to Jane C's point on prevention and societal equality specifically. Recently, the government have announced the latest statistics on apprenticeships, and since the apprenticeship levy was introduced, there has been a huge drop-off in the number of entry-level apprenticeships, those opportunities for people for whom the school system actually didn't really work, and those opportunities just don't exist at the moment. Now, I'm not against giving employers the decision about how they spend their levy. In fact, I'm very pro it. However, if we're going to avoid having an underclass of people who are underskilled and unable to raise themselves out of poverty, then we have got to have some positive action to reintroduce apprenticeships level 2 and level 3 as a priority. So that would be my first thing. The second one would be an appeal to stakeholders, really similar to what the other guys have said. Build a supportive culture. We can all do this. We can all be part of this. And there's a statistic out there that says for every £1 spent on supporting people's mental health, employers get a £5 payback on their investment in reduced presenteeism, reduced absenteeism, and reduced staff turnover. So why wouldn't you invest in that?
Yeah, when you put it like that, Jill, it's so compelling. Yeah, it speaks for itself, hopefully. And Paul, I'm going to come to you next, please.
Yeah, I think my point would be addressed to the sector itself, really. We've learned a lot about, over the course of the lockdown and the pandemic, about who to look out for, and quite a lot more about how to support them. I think what we really need to do now is to figure out how better to implement that learning at some sort of a granular level, in what might be termed as slightly more normal circumstances, or whatever the new normal circumstances are. That in itself will give a much firmer grounding to anything that we want to put forward in terms of suggestions for policy and support that we might want to look for government. But I do think we need to be much clearer ourselves about what it is we're looking at, what the issues are, and how to address them, and that will give us a much improved chance of success and actually being able to successfully address them.
Fantastic. Thank you, Paul. Jane C, can I come back to you, please?
Thank you. I'll try and make 2 points. One is mental health affects all of us. We all have mental health, just as we have physical health. I think we need a public health approach to this. If you compare this, we talk about parity between mental and physical health. We don't wait till people need a serious operation till we do anything from a physical health perspective. We've got lots of campaigns around stopping smoking, 5 bits of fruit and veg a day, etc. It's like mental health is in the dark ages. So we need much more prevention, much more of a public health approach. And the second point I would make is don't underestimate. I didn't come in on the discussion earlier about self-care, but it is that equivalent. You have to put your own oxygen mask on first. And that isn't just about self-preservation. It isn't selfish at all, because actually what you're also doing is learning and then modeling to others. This is what mental health is. It's okay to say, as you said earlier, David, you needed some space recently. You know, you've been cooped up with your family. That's not selfish. That's about you attending to your needs, and that's really positive. So yeah, self-care is really important, but we need much, much more prevention and not waiting for things to reach a crisis point.
Brilliant. Thank you, Jane. Liz, can I come back to you for a final word?
Sure. So to the sector, I would say be confident in being flexible, be positive that this is a time when we can make a real contribution as a sector. Our students are going to be our future. So let's really build them up to be that positive future that we want for them and we want for us. And I would suggest real focus on leadership development. So leadership that is confident to be flexible, kind and supportive to its staff, and is accessible. And through that leadership, keep the imagination open and encourage the ideas from our workforce to help us get through this shifting paradigm. To external folk, that's the government, the funding bodies and the regulatory bodies, I'd say FE is going to be a massive part of the solution. Have some respect for what we're doing, have some respect for our mental health and our financial resilience, and let us do the job that we could do if we had that power.
Thank you, Liz. Had to resist the urge to clap on that one. I'm very much with you. Nick, I'm going to come to you, and then I'm going to give Anna the final words of this roundtable, which has been really intriguing.
Thank you, David. I'll make two very quick points. The first being to the further education sector and leaders to really consider the mental education gap, to really consider how important that is to learners' performance and to staff performance, and to consider how and when to fill that gap. The second point is a point to government. It's not going to be about funding, although I do think more funding should be put into the space for mental health support and mental education. But this is a point about language, and to echo what Jane was talking about as well, about a national campaign, there is a need to bring the word fitness in with mental. We've got it with physical, we've got physical fitness, and that makes it attractive. That makes an outcome that is attractive to young people. It creates good and positive language. And that's what's behind the physical fitness culture, positive language and cultural change. Right now, that word fitness is absent when we talk about mental health. And my urge is for the government to think about a campaign not far from the 3 a day or the 5 a day that we've had with our physical health, to think of something that really raises mental fitness as a national campaign for better language and positive outcomes, so we can encourage young people to aim for mental fitness, not just physical fitness.
Fantastic, Nick. Thank you. Very wise words. And Anna, I'm going to hand over to you for those final words.
Thank you. Thanks, David. And I think my first point would be around opportunities like this. I think for all of us, and hopefully everyone listening in, everyone will realise how valuable it is to make time and create space in a safe and supportive environment to actually talk through where we're at and to share our experiences and those of our colleagues and those that we're working with and our families, and bring all of that into the mix to be able to work together to collectively try and create or navigate some of these solutions that might be needed going forward. And then also one thing that's been on my mind as I've been sat here listening today is thinking about apprentices who are kind of uniquely placed because they are with an employer, of course, for the majority of their time, but they are also with the training provider as well. And therefore, equality of access to services should you need them, and that support possibly could, I think this is an area we're going to need to look at, because I think perhaps depending on the employer that you're with or the training provider that you're with, you may have greater or lesser access to those support services that you're going to need. So I think my final plea is a big call, probably on the government, that no matter who you are, where you are, your age, your level, your geography, your job role, your personal situation, whatever your personal circumstances, if you need support and you need help in the coming weeks, months and years, that you have equality of access to the support services that you need and that you can get to them quickly, so that we really do start to address and support everyone in this country who's possibly going to need help going forward. Thank you.
Fantastic, Anna, thank you, and such a great way to finish today's roundtable. So that just leaves me to say 3 thank yous. Thank you to FE Week for helping us to bring this roundtable together and getting such a great panel of leading figures in the sector. Thank you to the panelists who've been involved in this conversation. And finally, and most importantly, thank you to the listeners, people who've listened and watched this roundtable today. I hope you found it as interesting, insightful, and hopefully practically useful as I've found it today. And I'm saying thank you because you've given us your time, and that's your most valuable commodity. So I hope you've managed to listen to this if you've got to walk outside in the sunshine and you're practicing some of that self-care and preventing, building your mental fitness to be able to deal with everything that's going on in the world. Thank you, everybody.
Evidence to improve mental fitness and student outcomes in just 5 minutes per day. The only app of its kind, FIKA is designed by experts to develop the 7 skills of mental fitness, which are proven to prevent mental health decline. Better mental fitness can lead to greater outcomes, including increased student performance and confidence, improve stress management, reduce dropout rates and burnout, and meeting Ofsted targets. Better mental fitness also supports students' employability when they leave education. Measurably improving mental health in education is a huge priority for us. That's why NCFE has partnered with FIKA to offer 1 year free usage of the app to a limited number of further education providers. Licenses have already been claimed by providers around the UK. To get involved, book your place on one of our Discovery demo sessions today and find out how to claim your centre's free trial.